Namaste. I am Professor Dr. G.G. Gangadharan, practicing at Bhadrappa, Bengaluru, with 40 years of experience in the clinical Ayurveda medicine. Ayurveda is rich man's disease, they say. It is because of excessive nutrition in the body which is not got metabolized. So Ayurveda says that take things, that foods which are against the excessive fat, starch and protein in the body. And the reason for being this advice is that body is made of excessive weight in the system due to a kind of deranged metabolism. So the food which is helping in increasing the metabolic rate of the body and which will not add extra starch and fat and protein to the body is the principle of Ayurvedic dietary management. And the main food that we describe for that is which are slowly getting digested to the body but easy to digest. In the modern times we say low glycemic index food items. So food with high fiber like red rice, boiled rice, brown rice, and the classical traditional rice varieties are good in as one of the grains. But more than rice, Ayurveda says that go for millets. Millets has got less starch, more protein and more fiber. Any kind of millets are advisable in Ayurveda, but excess of steamed and or boiled vegetables are part of the diet. So one of the best way of controlling your diabetes as per Ayurveda is to divide your food into 4 categories, especially for the breakfast. Take a small bowl of steamed vegetables and make it a tasty one by adding spices, little bit of onion kind of things and curry leaves, jeera, cumin seeds kind of thing. So that this every day you have to take that food, so you make it tasty and palatable. Small bowl of steamed vegetables, overcooked vegetables, shoot vegetables, which is large, it is high in fiber. Second bowl, small bowl should be steamed or boiled pulses, especially moong dal, that is green gram with chilka. If you overcook it, it will become very easy to digest. This also should have some condiments kind of jeera, dhania, pepper and onion if you want. Sprinkle little of coconut oil to that so that it is tasty and you look forward for eating it. Third bowl should be any grain made out of millets dosa, millets puttu, upma, anything. Fourth bowl is fruits. But all fruits are not good for diabetic. But generally, pomegranate, papaya and guava, this can be selected for diabetic people. So I advise the 4 items in the morning, small quantity, this way, because this way if you eat it, the absorption of the glucose into the system, bloodstream will be slow and very well regulated. Lunchtime you can take the normal South Indian type of sambar, palya kind of thing, but more vegetables. And all spices are good for diabetic people, but less of red chilli, because red chilli is little inflammatory in nature. So with boiled rice, 30%, 70% vegetable is a good lunch for one. And night also more vegetables, steamed vegetables with some kind of grains. That also can be a roti if you are a North Indian kind of a diet seeker, or grains of millets. Anyway, you can cook it as a rice, as a upma, but steam it or boil it. Never deep fry things, diabetic people. Never ferment the food. Never overheat the food. Punartaptam vishobhamam. We say that any food that is reheated once cooked is not good for health. And in between you have to drink boiled and lukewarm water with a pinch of jeera or dhania. Never drink blank water. Blank water will not, even boiled, will not be carbonated or digestive. So this is a general principle of diet in diabetes. Diabetes is a Kabaja predominant disease. All the food that is against Kaba accumulation is advised here. Actually, there is no concept of insulin sensitivity in Ayurveda. From Ayurvedic point of view, we select such combinations of drugs, plant, mineral or animal origin materials combined in a form which works against the accumulation of sugary things in the blood or in the tissues. What I mean here is sweetness is increased in the body. Here all the dravyas which are against this thing, which are predominant in hot, Viryam and Tikta Rasam and Ushna Rasam and astringent rasams are selected. So, one of the best dravyas we do in Ayurvedic parlance for diabetes as a treatment is Amalagi and turmeric. Turmeric and gooseberry is a good combination dravya in almost all kind of diabetes mellitus, which comes under the Madhumeha category of Ayurveda. So, if you are every day taking this gooseberry and turmeric, actually it is a partly medicinal, partly food. So, it is a junction between the two, and both way it can be taken, and we normally tell people take it in the morning, empty stomach, 1 glass of gooseberry with a bit of turmeric in that. So, as far as the medicines are concerned, there is all group of medicines which are told in Ayurveda that has to be selected by a good clinician based upon the prakriti of the person, the disease condition of the person. But generally we use Guduji as a primary thing in many conditions of Prameha, Guduji, or a plant which is commonly used all over the country as a anti-diabetic medicine. That's one thing. And second thing what we use is Haridagi, Vibhidagi and Amalagi, which is known as Tribala. Tribala has got the tremendous quality of decreasing the kapha in the body. Even though it is not directly indicated for diabetes, a very good powder to be used by diabetic people, especially in the night. There are such umpteen numbers of dravyas which improve the insulin sensitivity and improve the functioning of the islets of pancreas, that is islets of Langerhans in pancreas. So, we use Visamalagadi Kashayam, Katagadhiradi Kashayam. This kind of combinations of Ayurveda Kabahara dravyas are extensively used. We also use things which are bringing down in the body like Varanam, this kind of Kaitaiva, Nirvala kind of things also. But this is actually it's the area of a expert physician. I am just giving you indicative elements of Ayurvedic drug that can be used. Actually, diabetes mellitus is like a permanent bank account. But if you are very intelligent and smart, we can correct your lifestyle by making maximum movement to the muscular system, nervous system and circulatory system. So, what we say is that if you want to reverse diabetes, early stages, what you have to start doing is look for the right kind of diet, which I explained to you earlier, plus Vyayama. There is nothing to replace or substitute correct exercises. The correct exercise in Ayurveda is the one when you do for some time with the full movement of the body, for example, walking little fast pace, swinging your hands, your nose should sweat. That is a sign that you have exercised sufficiently. So, 30 to 35 minutes walking in the morning is sufficient if diabetic people to reverse their sugar consumption in the body with some kind of diet correction, and never sleep in daytime. If you feel sleepy, make sure that you sit in an inclined position, take rest, a power nap, keeping the legs straight on a stool and take a nap, absolutely no problem. But lying down is very much against diabetic people. Second important lifestyle changes is that never compromise sleep in the night. Don't carry your phone to the bedroom. Keep it away and don't let us not luminous light hit your eyes so that your sleep will be disturbed. If you practice sleep of 7 to 8 hours a night with proper food in the evening, your diabetes can be reversed. Most important thing other than is that you should not get into stressful situations. Stress is the one of the reason for sugar to immediately flood in the blood. So, be calm. We normally teaches people do simple pranayam, the relaxation techniques, and don't get involved in worldly things too much which you cannot handle. So, stress busting is one of the important things we should do other than medicine and diet and exercises. If you are able to do these 4 items in a balanced way, your diabetes can be reversed. So, my advice to anyone who is seeking a clear management or reversal of diabetes to follow diet, exercise, sleep and stress-free life. If you are ready to do, even though you are genetically engineered to get diabetes, it can be delayed or it can be stopped and it can be controlled. There is immense experiences in people who are dealing with diabetes by merely correcting this kind of thing, especially early stages of diabetes, that can be reversed. Thank you.